phones?
No.
Have you got it on iPads? Have you got another screen up?
If you were in the lobby is live streaming as well. And so it may be live streaming in both the lobby and the webinar. So if you just find where the lobby was, and just press pause on that stream, that's most likely what's happening. That's most likely what's happening. That's most likely what's happening. That's most likely what's happening.
Well, sorry, folk, we're trying to.
I think that's it.
That's it. Great. All right, Masataka, let's go back to the start. Sorry, guys.
Yep. All right. So my name is Masataka Enomoto, Research Assistant Professor of Orthopedic Surgery at NC State, together with Dr. Duncan Lascelles. And as all know, he's a professor at NC State. And we are talking about the early identification and management of osteoarthritis.
Great. And hello, everyone. Yeah, my name is Duncan Lascelles. It's my honor and pleasure to be speaking alongside Dr. Masataka Enomoto. Just a quick shout out to Dr. Masataka Enomoto. I was trained by John Holton, and right up beside John Holton, Masataka is one of the individuals who I think is an absolute expert at assessing gait and movement in dogs. So I really enjoy working alongside him. And we're going to be presenting some data today. Just go to the next slide, please. Presenting some data today from a study that Elanco funded. Now, Elanco are supporting this webinar, and we are presenting results from an Elanco funded study. I'm an advisor to CAM, and both of us, both myself and Masataka, have received consulting fees from Elanco. So you should be questioning whether or not this presentation is biased or not. We both believe it is not biased, but if you feel it's at all biased, do call us out on it. Let's move on to the next slide. So let's start off by talking a little bit about the prevalence of osteoarthritis. And let's look at humans first. So we pulled some data here. It's from a Canadian study. There are a number of other studies that look very similar. And essentially what you're seeing here is along the x-axis there are age groups, and on the y-axis, the prevalence of osteoarthritis. And so as you move along from left to right, you see the height of the bars increases. That means as you're moving through the age brackets, the prevalence of osteoarthritis in both male and females increases with age. Next slide. So now let's start to think about dogs here. So when is OA diagnosed in dogs? And by OA, we're referring to the combination of osteoarthritis, the disease, and its associated pain. So I think, and that's an important important thing for all of us to distinguish between. Are we talking about OA, the disease, or are we talking about what we'll refer to as clinical OA, the presence of the disease of OA and clinical signs associated with it, which is essentially pain associated with it. So OA is diagnosed in dogs. Roughly, half of the cases are diagnosed between the ages of 8 and 13 years of age. So older dogs. And the median age of first diagnosis of OA is about 10.5 years. This is from one particular study, but a variety of different studies, and certainly the clinical trials that are run would support this, that OA is diagnosed later on in life in dogs. And the next slide. So with that, then, if you look at the human data, and we understand when OA is diagnosed in dogs, we could easily conclude that OA and associated clinical signs is an old dog disease. And so the question that we're posing to you is OA and associated clinical signs an old dog disease? Well, let's talk a little bit more about this, and we'll move on to the next slide. Another question, do these dogs have osteoarthritis? Now, we're not in a live forum here, but I think if, for example, we started with the dog that clearly has hip dysplasia, the ventrodorsal view of the pelvis there, if we started with that and we were in a live forum, our experience indicates that about half the delegates would say, no, this dog doesn't have osteoarthritis, and half would say it does. I think, people are a little bit split and unsure. Everyone knows that that dog has hip dysplasia. You can see that radiographically. The coxofemoral joint, which should be tightly fitting together, looks loose. Now let's just think about what happens there with that laxity. So puppies are born with a normal coxofemoral joint in hip dysplasia. It's just lax. With that laxity, as the puppies start to move around, you get abnormal loading of cartilage. Chondrocytes start to get annoyed. They push out pro-inflammatory mediators. Those pro-inflammatory mediators affect the synovium. We see synovitis become established. With that synovitis, you get more pro-inflammatory mediators, further annoyance of chondrocytes. Maybe you start to get breakdown of cartilage, compromise of cartilage. Everything I've described is osteoarthritis. And the message here is, as soon as you have developmental joint disease, you have initiated the disease of osteoarthritis. Okay, you might say, I want to see radiographic evidence because you gave me radiographs, you asked the question, do these dogs have osteoarthritis? Well, a little bit difficult maybe to see over Zoom, but I'm just going to ask Masataka to point out the Morgan's lines. See there, and then on the other side, a little bit more difficult to see there. That's osteophytes, where the joint capsule attaches. So we have radiographic evidence of osteophytosis. We have radiographic evidence of osteoarthritis. And we could go through the same type of discussion with the elbows there. We have these young dog elbows, but they are showing radiographic evidence of osteoarthritis as well as fragmented medial coronoid. And the next slide. So here's a really important message. Most OA in dogs results from developmental problems. It's a big driver of osteoarthritis in dogs. Hip dysplasia, elbow dysplasia, patellar luxation, osteochondrosis dissecans, early predisposition to cruciate ligament insufficiency. We are absolutely not saying that aging, obesity, breed, trauma, overuse don't play a role, but by far and away, the biggest drivers, initiators and drivers of osteoarthritis in dogs are developmental joint problems. And then I think we have to think, well, when do we see developmental joint problems? We see them in puppies. We see them really early on. So even just hearing this, we should be thinking, okay, do we see osteoarthritis as a clinical problem in younger dogs? And we're going to come back to that later on. Go on to the next slide. And so just, thinking a little bit more about developmental joint disease, this just shows the very stark difference here between the incidence of hip dysplasia in humans on the left and certain breeds of dogs on the right. So developmental disease is a big driver of osteoarthritis in dogs. Next slide.
So clearly, 3 examples of young dogs Dr. Lascelles and he showed had radiographic osteoarthritis. So what is the prevalence of radiographic osteoarthritis and associated clinical signs in younger dogs? So we performed a study to investigate this. Data already presented and has been published, and this study was funded by Elanco. The study was performed in a primary care practice at NC State. Inclusion criteria was dogs between 8 months and 4 years of age and 3.6 kilogram or greater. After our database search, 320 dogs matched our inclusion criteria. So these 320 dogs owners were contacted and offered a health screening. So the owners didn't know what is the purpose of our study. In the end, 123 dogs across 40 different breeds were enrolled. We attempted to balance the number of dogs in each age band, but this is the result. The project flow is summarized on this slide. Owners completed OA questionnaires, load questionnaire, and then dogs were examined for joint pain. Then dogs were sedated and two views of radiographs of every joint and of the spine were taken. Every joint radiograph was scored for the severity of radiographic osteoarthritis, then analyze data. This just gives you an idea of the radiographs we made. We just took lots of x-rays and literally all the joints, like we took x-rays. So let's jump right into the results. In the next graph, I'm going to show you the prevalence of radiographic osteoarthritis in age band. So as you can see, prevalence was increased with age, and dogs around 3 or 4 years of age, the prevalence of radiographic osteoarthritis was almost 50%. So these data equate to overall 40% of all these young dogs had evidence of radiographic osteoarthritis somewhere in appendicular skeleton. In terms of joints affected, elbow, hip, tarsus, and stifle were commonly affected. And importantly, I want to point out that often radiographic osteoarthritis was bilateral or affecting more than one joint. So our data shows that the prevalence of radiographic osteoarthritis in young dogs was 40%. So that is very, very high. So are you guys surprised about this?
But I can certainly comment here, Masataka. So I think we were all surprised, weren't we? I mean, so these young dogs, let's just remember between 8 months of age and 4 years of age, 40% of those young dogs, and we had a random selection of 123, 40%, 40%, had radiographic evidence of osteoarthritis somewhere in the skeleton. I think that's surprising.
Right, so we'll talk about clinical implications of these findings later, but a question we have been asked by people who have seen these data is, should we then be screening all dogs for evidence of radiographic osteoarthritis? The answer is no. We took whole body radiograph to investigate the prevalence of osteoarthritis, but we do not recommend doing this at practice. The cost of whole body X-ray is pretty significant, and then patient burden is significant too. Now also, like a radiographic osteoarthritis does not necessarily mean the joint is painful. So let's look at what we found in terms of joint pain. As you remember from this outline, we examined every joint for pain before we took x-rays. So this is a scale we used, and this video shows an example of moderate pain, which we can say confidently there is pain in the joint.
And I think it's worth just, if we just go back to that previous slide, Masataka, it's worth just pointing out, we're going to talk later on about how many of these dogs had moderate or greater pain. So just look at that pain scale there. We're doing moderate or greater because mild is, I think it's a little bit more difficult to detect those cases. So moderate or greater, the body obviously tenses, they may orientate to the site, may vocalize. So we're talking about that level of discomfort or greater when we come back to that point later on. And again, I just want to emphasize, everyone's got to be very careful when we talk about osteoarthritis. Are we talking about the disease, or are you talking about clinical osteoarthritis? Sorry, Masataka, let you get on.
All right, so in this graph, the prevalence of radiographic osteoarthritis in each age band is green, and the prevalence of clinical osteoarthritis, which is overlapping of radiographic osteoarthritis and joint pain, is blue. As you can see, not all joints with radiographic osteoarthritis were associated with pain, but there was a significant amount of moderate or obvious joint pain. Overall, 16.3% of all these young dogs had moderate or greater osteoarthritis pain. Another way of looking at this is that like 40% of all dogs with radiographic osteoarthritis have moderate or greater joint pain in the affected joint. So next, we wanted to know how many owners identified their dog's clinical signs. So now I have added in the prevalence of dogs with owner-observed clinical signs, which is purple bar. As you can see, owners did not observe signs of impairment in all dogs with joint pain. Based on the load questionnaire, in 30% of clinical osteoarthritis patients, their owners noticed some kind of signs of osteoarthritis. I know 30% is relatively low. I think there are multiple factors why this happened. Maybe because these young dogs may not be displaying signs of osteoarthritis pain in home environment, or owners are more likely to recognize clinical signs if only a single limb is affected, but less likely if bilateral joints are affected. As I mentioned before, bilateral or multiple joint osteoarthritis was not uncommon in young dogs. But on a positive note, owners are identifying 30% of these moderate pain cases, but clearly there is a room for improvement. Improvement may be partly achieved by improved owner questionnaires for younger dogs, but big key to improvement is likely to be owner education, educating them about possibility of osteoarthritis pain and signs associated with it.
Yeah, that's right. And if we can just go back to that slide, Masataka, just go over a couple of things. So as Masataka said, owner education is going to be important, but actually we all have to learn what the signs of osteoarthritis pain in younger dogs are, because as we'll talk about later on, they do appear to be different. I just want to double back on these figures as we build the picture here. So of all these young dogs, 40% had radiographic evidence of osteoarthritis somewhere in the skeleton. And of that 40% of those, which means about 16% overall of these young dogs, had moderate or greater pain in one or more joints that also had radiographic evidence of osteoarthritis. So if you just think about what is the prevalence of clinical osteoarthritis in this young dog population, it's about 16%. But in only 1/3 of those cases did owners apparently detect or see any signs of this discomfort. And again, as Masataka said, we think a lot of that is due to owner education, but also our ability as a profession to identify these signs. So moving on then, this is sounds like this could be a difficult thing to do. And I see a couple of questions that have come in already, addressing the difficulty maybe of doing puppy screenings, young dog screenings. So one question we could ask is, well, then why not just wait until these dogs are older and the clinical signs are more obvious? Let me just go on to the next slide there, Masataka. So here's the question. Why not just wait until these dogs are older and the clinical signs more obvious? Everyone agrees, okay, OA pain is present. We all agree, let's wait until that point before we start to deal with it. Well, if we go on to the next slide, the reason we don't want to wait, or at least we're suggesting we don't wait, is that pain negatively impacts multiple dimensions, and there are cumulative deleterious effects over time. Now, I'm going to say something that's a little bit provocative maybe, but arguably osteoarthritis, the disease, would be of no interest at all accept that it is related with pain or can be related with pain. It's pain which is the important factor, because it's pain associated with osteoarthritis that results in negative impacts on all of these different dimensions. And this diagram here just shows one way of parsing out these different dimensions. We've got cognitive function, social relationships, sleep, gait and movement per se, the ability to perform activities such as function. So all of these dimensions, these aspects of life, these components of bodily function can be adversely affected by pain. And these effects are cumulative and deleterious over time. Therefore, we'd want to go back, ideally, we want to go back when pain is just starting and address it then to prevent these cumulative deleterious effects over time. Because, we move on to the next slide, we firmly believe that it is these cumulative negative deleterious effects over time that is the reason for the classic dog with OA pain being so difficult to treat. I mean, think about it. We've spent a long time, and rightly so, a long time, talking about how to manage these older dogs with osteoarthritis pain. We talk about multimodal management. We talk about the fact they often don't respond appropriately to a single therapeutic. And I think a lot of that has to do with the fact that they have been subject to the effects of pain for many years prior to the time when they are easily identified and treated. And I say easily identified because things are dramatic. The dog can't get up, or it can't climb the stairs, it can't get into the car. That's currently where we are. We pay attention then. What we're arguing here this afternoon is to pay attention earlier on. Let's go on to the next slide.
And one thing to remember is that these negative effects are probably exaggerated in dogs with multiple painful joints. And multiple joint osteoarthritis is not uncommon in young dogs. So the exaggerated effect of having multiple joints affected start at young age. So in these young dogs, seeing a meaningful proportion of dogs with 2 or more joints affected. And another important factor is the effect on muscle strength early on. So this is a human data, human data showed that muscle strength increases at early life stage and then peaks at around 35 years old here. And then regardless of your joint health, muscle strength and muscle mass declines over time about 2 to 5% every year. So after 35 years of age, we should try to maintain muscle strength and then minimize loss. Otherwise, showing disability sooner, like stumbling, slower walking speed, something like that. So please note that lower starting muscle strength may lead to dramatic degrees later on. So there is no data like this in dogs, but there is a supporting data showing muscle mass body weight ratio declines with age in dogs. So if a dog has dysplasia, hip dysplasia, or other developmental joint disease, a peak of muscle strength may come earlier than 4, which is equivalent to 35 years of age in humans. And also the peak may be lower than normal dogs. So we could imagine that with young dogs with painful joints, we have lower muscle strength and then muscle mass early on. That may put them on a poor trajectory for later on. So young dogs with OA pain need physical rehabilitation and then pain management early on to optimize muscle strength. Also, I think now this makes sense. Early intervention to manage joint pain will prevent this cycle of progressive deterioration. If a dog has pain, they don't move, they lose muscle mass, then less joint support, and then more pain. So we have to stop this vicious cycle earlier. But please do not forget that like osteoarthritis pain affects multiple components, not just musculoskeletal system, as Dr. Lascelles mentioned.
Yes, and we're just going to reiterate that comment there. So Masataka nicely showed what some people have described, that is that kind of vicious cycle of deterioration with respect to the musculoskeletal system. But I think now we recognize that pain negatively impacts many dimensions. And so it's important to remember that the longer we ignore pain or the longer we don't recognize it, the greater the cumulative negative effects on multiple dimensions are.
So, okay, so now I think, we all agree that like early pain management is of benefit for all the reasons we have discussed. But this was a young dog where joint pain was evident on palpation, manipulation of the joints, but impossible to see any abnormalities when evaluating movement and activity. This dog's function is still pretty good, as you see in this video. So this is a really difficult case and then probably unrealistic to imagine like we will all be able to identify this dog now. But how do we move towards being able to identify the dog, like a tough case like this dog?
Yeah, and I think I've seen a couple of questions in the chat already about, it's difficult to even convince owners to have these young dogs undergo evaluations. Well, I think, and Masataka showed that lovely video there. We're entering an area here where things are not blatantly obvious, and we're going to have to learn how to detect pain associated with osteoarthritis in these younger dogs. And it's really because the behavioral changes are different early on. That's not to say the pain is less, it's just the behavioral changes are less. And they are different. So the behavioral changes are more adaptations. These dogs are really trying to work hard to adapt to the pain, to get around the pain, if you like. Currently, as I mentioned earlier, we are most comfortable making the diagnosis when things are dramatic, when things have really advanced and dogs cannot perform these activities. Prior to that, you see these adaptations, these behavioral changes. And so center to making the diagnoses are all members of the veterinary team. All members of the veterinary team have a role to play in the assessment of behavioral changes, watching the dogs as they come in, talking to owners, doing the evaluations. Let's go to the first build. And feeding into this is going to be the veterinarian's examination. We'll come back to that a little bit later on. Also feeding into this will be questionnaires, set questionnaires that are given to owners. They provide the answers, and even things like screening checklists, just to see whether or not, there may be the possibility of osteoarthritis pain present. Also, very important, I think we've all learned since the COVID days that videos from the home environment really complement that in-clinic assessment. So we've got all members of the veterinary team at the center here, feeding into this important components, the veterinary evaluation, owner-completed questionnaires, videos we get from the home environment. And you see owner education. Let's have the last build. See, owner education has popped up there. Owner education is based around the information we get from them through videos from the home environment, and also the information they provide us through these questionnaires. They provide us the information, we review it and go back to the owners and educate them. And so it's a real team effort here. Everyone has a role to play, and we all need to accept that we are in the learning phase here. Go on to the next slide. Now, these are two great cases, Masataka, and I think, yeah, you go ahead. But what I do want to point out, everyone look at the two sets of radiographs. They are from different dogs, but the degree of osteoarthritis in those two sets is not dissimilar radiographically. All right, take us through the videos, Masataka.
Yep. So I'm going to show you like two dogs with radiographically similar severity of hip osteoarthritis, as Dr. Lascelles, like he mentioned. But like a dog on the top is young dog, and then the dog on the bottom is older dog. So probably you don't see any obvious signs of osteoarthritis in this video. I'll play this again. First few steps may be a bit weird, but otherwise, this dog can go upstairs pretty well. However, this dog, now you can see this dog is struggling to climb upstairs. It's really obvious. So correct owner questionnaires were developed for bottom dog and may not be ideal for young dogs, but still like useful as shown in previously in my slide. As I mentioned before, they have similar degree of osteoarthritis, but like a bottom dog is really struggling with going upstairs, and maybe like a partly because of loss of muscle strength and muscle mass.
So I think this is a great, let's just go back that one slide, just focus on this. So this is a great illustration of what we're talking about here. Is the bottom video is easy for us. Okay, that dog has a problem and we're all going to take it seriously. The top dog also has osteoarthritis associated pain. It's more of a challenge to detect that. But if we're going to prevent that cumulative deterioration over time, those are the cases we need to be tackling. That's where we need to be having the conversations. That's where we need to be talking about what interventions are most appropriate and when. All right, let's go on to the next slide. So a couple of things to remember. Many dogs have more than one joint affected by OA. So let's move away from this idea of the classic description of lameness, the limping dog. Because bilateral disease, as Masataka mentioned, is common in dogs, and that will often remove the signs of an obvious single limb lameness. And also remember this idea of adaptations in function. So dogs, these younger dogs with osteoarthritis pain, moderate or greater pain, are still going to be walking, still going up and down stairs, still trotting. But what we are looking for are adaptations in function. They're adapting their movements to try and cope with the issue. All right, let's move on to the next slide. And oh yes, it's kind of an illustration example time. So this is a normal dog. Well, it's a silhouette of a normal dog standing. I think anyone looking at that dog thinks, yep, that looks like normal stance, normal positioning. What we're talking about here is observation. We want to give a few examples of observation, which is so desperately important, and arguably, I would say, more important than the orthopedic evaluation itself. So when you see the next picture come up, I want you to think to yourself, is this a normal stance? Does this look like it? Is this look like a dog that's standing normally or abnormal? So just normal or abnormal. Is that normal or abnormal? And Masataka deliberately removed that image because I think you've all got it right. You don't need long. Let's bring the image up again. You don't need long. Just looking at that as a veterinary professional, you say, that's not right. You know it. So we know what to look for, and we can identify abnormalities very quickly. So just looking at this picture here, yes, this is a classic position of a large breed dog with bilateral hip osteoarthritis pain. It's kind of leaning forward there. You see the upright hind limbs. You can even start to appreciate, despite the fur, the hair, that there is muscle atrophy, muscle wasting on those hind limbs. I think the one thing that most people pick out first is what appear to be the hyperextended hocks right down at the bottom there. There we are, hyperextended hocks. In fact, this dog was referred in for bilateral hyperextended hocks and to manage those. There's nothing wrong with the hocks. It's just this dog has been leaning forward for so long that those hocks have gradually extended, and gone into hyperextension. Let's go on to the next slide. What have we got? Oh yes, let's play this video. And this is a young male Rottweiler, less than a year of age, and just being walked down the stairs there. So what do you think of that? And then we turn around. It's a very hot, sunny day in North Carolina. And then I think I get the gentleman to come down again. Something's distracting the dog up there, but here we go. So young male Rottweiler, less than a year of age. Now that to me is not how that age of dog should be going down the stairs. See, it's still going down the stairs, but the adaptation is that it's being cautious. And why is it being cautious? Because the weight's being thrown forward and it doesn't want to put weight on either forelimb. So top of the differential list should be elbow osteoarthritis with associated pain. That's the important thing. Let's go on to the next slide. All right, this is a good one. Now watch this movement and we'll talk about it. Just imagine that I often do the gait evaluation between the waiting room and the consulting room, the consultation room. So just watch that again. And I see a couple of people in the chat have already picked out the hind end sway there. Now, again, this dog is still walking. So if the bar is simply set at, is the dog walking or not? Well, it's reached that bar. The dog is walking, but it's walking with an adaptation. And I'm not going to get out of my chair here and show you, but the reason for the hip sway is that this dog has bilateral hip osteoarthritis and associated pain. It wants to move forward, but it's trying to limit the flexion and extension, in particular extension of the hip joint. And so to do that, the hip joints are relatively more fixed, move less, and that sway throws the hind limbs forward on one side, then throws the hind limbs forward on the other, and helps that dog effect forward motion. Let's go on to the next slide. Now, this is a tricky one, and it is probably not going to come over Zoom very well, but this is a milder case here of hip osteoarthritis and associated pain. Yeah, I don't think it's really playing very well at all. But what you would see if you watch the video on your desktop here, is you would see at the walk, you get a marked hip sway. At the trot, that disappears. And I think one of the reasons that disappears is a trot is closer to free fall, and with free fall, you use the mechanical, if you like, spring in the distal limbs more, and so relying less on those hip joints. So these I think can range from obvious adaptations, but we need to recognize them as adaptations, to the more subtle and more difficult to identify. And the next slide. And this is not subtle at all. So as part of a study, we had cameras in the ceiling here and just watch this hip sway. And I think you can also see the muscle atrophy at the back end there. And that I think for a lot of people, we just accept that as, oh, that's normal, maybe even cute. I think we have to be asking the question, is that hip sway an indicator of hip pain? In this case, bilateral hip pain. And again, I think you can see the muscle atrophy at the back end. The back end of that dog looks like the front end of a torpedo, doesn't it? All right, what have we got coming up next? Oh dear, picture of me. So before I talk about the orthopedic examination, just want to emphasize the role of observation. And I think is something which increasingly we are apt to overlook with with the explosion of diagnostics and imaging, but we shouldn't overlook that observation. That observation is so important because we need to be evaluating these patients for those adaptations in movement. And you will see that through observation, careful, critical observation, and don't forget the value of video from the home environment, particularly for dogs that are nervous coming into the practice. Now, I've mentioned this a few times, the orthopedic examination I relegate to a less important status, if you like. It's still important to do. And I think, one of the things that I've seen talking to practitioners and going into practices is a reluctance often to do the orthopedic evaluation, possibly because of people like me and the experience that veterinarians have had during vet school of these orthopedic evaluations being these long drawn out affairs, 30, 40, 50 minutes of back and forth, walking the dog up and down, umming and ahhing, everyone examining it. Well, I'd encourage you to take a look at some videos at that URL that's on the screen. I go through how to do an orthopedic evaluation, how to assess the muscle mass, sensitivity, forelimb joints, hind limb joints, and I do show a real-time orthopedic evaluation. Hopefully it's to try and convince you that you can do an appropriate orthopedic evaluation, particularly as an assessment for OA pain within just a few minutes, 2 to 3 minutes. Let's go on to the next slide. All right, so to summarize this part then, developmental disease, what we're making an argument is that developmental disease is a big driver of the disease of OA. And when we look at young dogs, again, between the ages of 8 months and 4 years, 40% of those dogs, and it was across a lot of breeds, I think, how many different breeds, Masataka?
40.
40 different breeds. So we're not just looking at Labradors, not just looking at German Shepherds. So 40% of those young dogs have the disease of OA as defined radiographically. Let's go to the next build. And that can be associated with pain. And overall, we're looking at about 16% of these young dogs have moderate or greater pain driven by osteoarthritis. Next slide. So now we've sort of set the scene here. We want to, and we've made the argument that these should be managed earlier on to prevent those cumulative deleterious effects over time. And so how are we going to do that? Well, I think I saw a question in the chat that, or a statement that it's difficult to convince the owners of young dogs to treat their pets with analgesics for between the ages of 3 and 17, 18, the life of the dog. That is not the approach that I would say we should be having in our head. The approach I think we should be having in our head is that we need to aggressively, appropriately treat these early on, but that doesn't necessarily mean to say lifelong analgesics. So let's build this up for you. What we recommend is essentially somewhere between 1 and 3 months, depending on the starting severity, 1 and 3 months administration of an effective analgesic. Over that time period, we then instigate an exercise plan, which is essentially gradually increasing exercise. We're using the analgesic to effect pain relief to allow gradually increasing exercise. At the same time, we optimize the diet. And by that, what we mean is adding in omega-3 fatty acids, marine-based oils into that diet, as there is reasonably good evidence of a mild to moderate pain alleviating effect there. So we're going to alter the diet, optimize the diet. We're going to use this time to try and optimize weight. Many of these young dogs are actually overweight. And we're going to be engaging the owner. We're going to come back and talk about that more in a little bit. Let's go on to the next. And then as we build this up, so using this effective analgesic, we're going to use an approved drug if we can. We're going to dose on lean body weight, monitor for side effects, which essentially means getting a baseline. And then really the most important time is 2 to 4 weeks after starting the analgesics to reassess for not just side effects, but also for efficacy. So is this therapeutic being tolerated, and is it efficacious? In terms of exercise, we'll start off with 2 weeks of no change in exercise, allow analgesia to be instigated, then start gradually increasing the exercise. And what we do, because it's rather vague, the term gradually increasing exercise, What we do is we actually write this out. So we find out how much exercise these dogs are having as a baseline and then gradually increase that over time. And there's no magic way of doing this. It's just gradual, and something like an extra 5 minutes per walk every week is a good rule of thumb. And the next slide. All right, so Masataka is going to share a little bit of information because we ran an open label study to test this, to see in young dogs, does this type of approach make a positive difference?
Yeah, so like now I'm sharing with you some real world data on the treatment of these young dogs with moderate or greater pain. The population in this study is the kind of initial target we should start treating soon. And this is prospective open label study containing grapiplant. Inclusion criteria of this study was dogs between 9 months and 4 years of age with moderate or greater pain in the radiographic osteoarthritis joint and body weight of 3.6 kilogram or greater, and then load score of 5 or greater. We think the treatment regimen we provided in this study reflects types of approach that would be used in practice. This approach includes NSAIDs, nutritional supplement, and exercise. And then this was given for 4 months for this study. Briefly, grapiplant was given once daily, at least 1 hour before the meal. 100 milligram per kilogram of fish oil was given for a week and then increased to 200 milligram per kilogram from the second week. The owners were asked to add 5 minutes of leash walking every week and then increased to 40 minutes twice daily. Outcome measures were owner-reported outcome measures, questionnaires, and then force plate. And they were collected every month for 4 months. So now let's take a look at some before and after treatment examples. Videos are very useful to diagnose osteoarthritis and check the progression of disease or efficacy of treatment, as Dr. Lascelles mentioned. And the patient in these videos, I'm going to show you actual study patients and all young dogs, but has difficulty, different severity of pain in different ways. So the first dog is Samson, who has multiple joint osteoarthritis. Samson was one of the more affected dogs, and treatment is ongoing. As you can see very easily, he is hesitant to go downstairs. He managed to go down very slowly, but both forelimbs are landing at the same time. And going upstairs is more difficult for this dog. Right, so let's look at the after 4 months of treatment. He's hesitant, still hesitant to go upstairs, but much better. And hopping, still hopping, but he can go upstairs now, and he looks much happier. Going down is much faster too, compared to before treatment. Now, still both forelimbs are landing at the same time, but sometimes use alternating legs. Okay, so this is the second dog. Jax has right elbow osteoarthritis. The way he sit down is kind of interesting, and you may not be able to see his abnormal motion pretty soon. But if you keep looking at his right front, you should be able to see he lifts up, his right front right before sitting down. So this is 3 months after treatment. He's back to normal. He's using right front correctly. and there is no issue. Okay. So one of the most common signs of osteoarthritis associated pain is lagging behind on walks. During the study, we walked the dogs for 10 minutes to collect motion data and our exercise. And this is Henry, who has multiple joint osteoarthritis. Before the treatment, he was lagging behind. And this is 3 months after treatment. Now, this dog is walking beside me. Well, some of you may say, this is just because I'm walking slower. 3 months. But how about this? This is the same dog, Henry, as part of motion analysis after 10 minutes of walk. We videotaped the dog going up downstairs. So this is before the treatment. As you can see, this dog was very hesitant to go upstairs. This is 3 months after the multimodal treatment. So you see, he is now going upstairs without hesitation. So definitely, as you saw, young dogs can get benefit of treatment. So through this study, we learned a lot about how these dogs are affected and what signs they show. This is a conclusion. As you saw on the videos, treatment regimen was efficacious, and also importantly, treatment regimen was well tolerated.
Great. So just before we move on, someone challenged us recently, said, no, those dogs don't look like young dogs, look like old dogs. Henry there was just under 3 years of age at the end of the study. And something that Masataka and I have commented on, some of these younger dogs, particularly those that have greater levels of pain, they do look older. They look like pain has aged them. And I think that's part of, you really pain starting to grab hold and deteriorate these poor cases. So one thing I want to finish up here by stating is that we don't believe medical treatment is necessarily lifelong, especially early in the disease course. Management of OA is lifelong. And so let's go to the next slide, Masataka, and build up this argument. So if you start with an effective analgesic strategy, that is then going to decrease pain. If we decrease pain, then we start to see a number of improvements. We start to see an increase in movement and exercise. That increase in movement and exercise is going to help with weight management and also increase muscle tone and mass. And those in and of their own right are going to decrease pain. Further, the ability to move around, engage in life, and having less pain improves the affective state. That's going to have a positive impact and decrease the amount of pain that is perceived. An effective analgesic strategy is going to help normalize joint biology, which is going to further decrease pain. And so now we come to a situation where we have less pain to deal with. And I think this is a really important point, that the disease of pain is dynamic. If you leave it, it gets worse. If you treat it, it gets less. That means you can potentially go to longer treatment intervals, and you have less of a need for an analgesic. And so I think, our approach here is, and we don't have data on this over the lifespan of dogs, but certainly over the last couple of decades, this is an effective approach that I've used, which is to come in effectively early on, reset everything, instigate those lifestyle changes, and then aim to remove that analgesic. On to the next slide. And so after we've had that, few months of an effective analgesic, increasing exercise, optimizing diet and weight, we want to reduce the dose or frequency of that analgesic with the aim to stop the drug or the biologic, maintain exercise, maintain diet optimization, maintain optimized weight. So those lifestyle changes are important. And we go on to the next slide. And that's not easy. You know, just think about what we're asking owners to do. We're asking owners to pay for, potentially administer themselves an analgesic. We're asking them to feed their beloved pet less. We're asking them to exercise their pet more. And I know how difficult that is, finding time every day to do that. We're asking them to aim for often weight reduction. This is difficult. We need to engage owners. We need to embrace them as a team member. It's not us and them. Embrace them as a team member, set and talk about expectations, help them to understand why we're doing this. When they see the benefits, that's when you really start to get traction with these owners. And often then they end up being the ones who are driving further optimization. And the last slide.
Okay, so this is conclusion of our talk. Radiographic osteoarthritis is very common in young dogs. In our population, 40% of young dogs, they had radiographic osteoarthritis. Among these young dogs with radiographic osteoarthritis, 40% of them had clinical signs with at least moderate pain in one of the appendicular joints. Identification of OA pain in young dogs relies on identifying adaptations in movement. Like owner education is a key to identify adaptations in movement. Early effective treatment produces benefit of these young dogs.
But remember, we're not necessarily saying treatment has to be lifelong. You need that effective treatment early up, lifestyle changes, and continual reassessment is important. Maybe you'll stop the analgesic and you may have to come back to it later on.
Oh, my life. Amazing. The questions are thick and fast. So unfortunately, due to time, we're not going to tackle them today. And we're not even going to attempt to tackle them today because we're not going to do them justice. What I am going to do, and Duncan will find this funny, I will terrorize Duncan until he gives in and comes back on cam and brings Masataka, and we'll tackle them at a later date. But I think we won't do them justice to try and answer them now in one minute.
We can absolutely do that. Yes, I'm volunteering Masataka. And we did as we went through, we tried to address some of the questions that were coming up. And I think hopefully some of the earlier questions were addressed later on in the seminar.
Definitely. And I've put a link to the paper so people can, get a cup of tea and have a paper because some of the questions are in there. I definitely see a trend that people want to know more about neutering. And that's influence. There's people that want to know more about what happens if you don't see radiographic signs of OA. Could it still be OA? Which we can answer that as well. And there was another one which I think is very relevant, is how sensitive are the tools that we have available, these questionnaires? Do we feel that they are really going to pick up on these early signs? So I will endeavour to make sure that we get Masataka, who's been volunteered by Duncan. Sorry, Masataka, to come onto cam, and we will tackle those topics. For now, I want everybody to seriously say thank you. 360 of you. These people have given up their time to come and join us on the weekend. It's a massive feat. So get your thanks in, and we'll say goodbye for now. I'm going to hop over and start with Tammy. We've only got 2 more lectures to go, and day 2 will be done. So thank you very much, Duncan, very much, Masataka. Take care, guys.
You're very welcome. Bye, everyone.